रागादिरोगान् सततानुषक्तानशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै. So apparently when the Annavaha Samsthana gets bald-faced, so that is how I would like to call about Ajeerna. So there are two cases that I have considered at first before speaking about Ajeerna. So what are all those topics that we have to understand or we have to identify before pinpointing some roga like to be diagnosed as Ajeerna? So what are those stages that we have to understand that we will know? Okay. These are two cases which I have taken, which are not apparently just Ajeerna, but the samprapti has still more manifested. But still, I have taken this case to explain you how pachanakriya happens in the body and where it deviates, at what point it deviates. Until and unless we understand what is Jarana Shakti, what is Abhyavarana Shakti, and how these change and what changes them, like what is the controlling mechanism which changes them. Until and unless we understand this topic, we cannot probably go further and say this is mandagni, or this is vishamagni, this is Ajeerna, or this is grahani, any other disease per se of the Annavaha Srotas. So before understanding the rogas of Annavaha Srotas, I would intend you all to understand what is Annavaha Srotas. So what is the anatomy and physiology of the Annavaha Srotas? So that Rachana and Kriya we have to understand first. I'm not going into the depths of Rachana here saying these are the organs and such, but yes, I would like to touch upon all those aspects as well in brief. So the first case we have considered here is of a female patient aged 52-year-old visiting our hospital. So this is an article which is published from our hospital saying there is pain in the abdomen. You have to first understand what is the age of the patient here, 52-year-old, keep it in mind. Then pain in abdomen, loose stools after 2 to 3 hours of consumption of food. She defecates yellowish watery stools 3 to 4 times a day with pain since 8 years. Okay, keep this in mind, the time duration for every complaint. So loose stools after 2 to 3 hours of consumption of food, and she defecates yellowish watery stools 3 to 4 times a day with pain since 8 years. So she consulted the nearby hospital and took treatment. The symptoms got reduced after 2 years. The same symptoms reappeared along with the burning sensation in the epigastric region and sore belching. Again, she consulted a doctor and took treatment. They advised for colonoscopy, but she didn't undergo the colonoscopy. Gradually, she observed easy fatigue and marked reduction in the body weight. So, approximately from 69 kg to 58 kg, that's drastic. So, she came for further advanced treatment in Ayurveda. So, what does this case tell you about? So, why there was pain in the abdomen? So, why I have listed out the symptom here is because how we understand these symptoms is with the avasthapaka, how it goes in the Annavaha Samsthana, how this avasthapaka takes place. So this avasthapaka with the reference from the Grahani Chikitsa Adhyaya of Charaka Chikitsa 15 chapter. So we will have to understand in which avasthapaka, what are all the changes that are going to happen in the Koshtha. So what that change is gonna bring to the person, like what effect can it bring to the Vata dosha, Pitta, Kapha dosha, what it can bring to the environment, the habitat of the Amashya, Grahani, Pakvashya, and what changes it can bring to the Agni, both in the terms of quantity and as well as the quality. Okay, so these things we have to understand. So loose stools after 2 to 3 hours of consumption of food, what this would say to us. So first there is pain in the abdomen. This will be thinking like pain. Suddenly we relate it to vata. So which avastha would it be? So we will be thinking of Pika to avastha might be, but pain in the abdomen can be of different reasons as well. It can happen in Kapha, like in the Madhura avastha also, in the Amla avastha also. So we will have to differentiate it this way. So when a case is given to you and you have to diagnose finally that case as Atisara, Pravahika, Grahani, any case it might be. So what is the differential diagnosis that you are going to give to that case? You know, so what you will be doing, generally what you students tend to do is to give the differential diagnosis according to modern terms, saying there is hyperacidity or there is GERD, there is IBS case probably or Crohn's or ulcerative colitis, saying like this, or some peptic ulcers might be. Or if you're a little more peculiar kind of a student, so then you would be going for telling it as Ajeerna, then as mandagni, Ajeerna, Brahmani, like this, you would be giving a differential diagnosis. But what makes the difference in giving the differential diagnosis in the physiological aspect of the Ayurveda Kriya shareera of the pachanakriya? So this should be your aim, not just giving the differential diagnosis in terms of the disease, in terms of the vyadhi. Okay, so just by looking at the symptoms that the patient is presenting with, you should be able to tell what is the physiology and where in all the physiology of pachanakriya has gone wrong. This should be our aim, because Ajeerna is a very primary disease of the Annavaha Srotas, right? But in that Ajeerna only we have so many types. So what is causing that so many types? See, the importance is not just for dividing it into six types of Ajeerna or four types or three types of Ajeerna, but what is the basis for that differentiation is what we need to learn. If we can try to learn what is the basis behind this classification, then a teacher need not come to you again explaining what is the basis of types of Adasara, types of Grahani, why it has been classified like that. See, Acharyas have thought of something before giving you that classification, that four or five types of classification, right? So, what was the thought behind giving those types of classifications or those type of vyadhis that we have to understand? So, in the pain abdomen, what is the physiology that is going behind? Loose stools after 2 to 3 hours of consumption of food. So, you might also think here loose stools can happen just after taking food, 1 hour after food, 2 to 3 hours after food, or it may be 6 hours after food. So, what makes the difference? What is the dosha play that is going behind the curtains, saying in this patient, loose stools has to happen just 2 to 3 hours after consumption of food. So, what is that avastha which is going wrong here, resulting in the loose stools after 2 to 3 hours of consumption of food? This is the way you have to think. Okay. Then the third point in this case is saying she defecates yellowish watery stools 3 to 4 times a day with pain since 8 years. So there are four things here. What is that? Defecates yellowish stools. That yellowish stools is not a solid or a semi-solid stool. Rather, the second point is watery stools. And the third point saying 3 to 4 times a day. Then fourth point is with pain. It could have been without pain, right? It could be without pain, but here it's with pain. That's the fourth point. And the fifth point is about the chronicity of the symptom. That is saying 8 years. So there are 5 points just in one single sentence of a symptom. So which are all the avasthapakas that has gone wrong here? Finally leading to a certain samprapti where the samprapti has continued for 8 years, giving the symptom of yellowish watery stools 3 to 4 times a day with pain. So what are all the avasthapakas that might have gone wrong, and what are all the dhatu and dhatvagni, bhuta bhutagni that might have gone wrong in these span of 8 years? So finally she consulted. Then again, after 2 years, these symptoms have reappeared along with, see, before it was milder symptoms. Now after 2 years, again, after taking treatment, 8 years she suffered, she took treatment, it got little relief, but after 2 years, so that might have be said as 10 years of this disease. So now she's getting, along with all the symptoms she previously had, she's now getting burning sensation in the epigastric region, sore belching. Again, she consulted the doctor. Okay, so this is symptomatology in its chronological order. So why did this burning sensation start now? Why did this epigastric region, there was, sorry, burning sensation in epigastric region only? Why couldn't it be in the stomach? Why couldn't be it in the intestines? Why couldn't be it in the rectal region, anal region? So there is some specificity saying burning sensation is there in epigastric region only. So it's very easy to say curve okay? But curve is not some abstract term. Why we have to understand why the curve happened there only. That is the role of a Vaidya. So today's discussion is about Ajeerna, I understand, but what I want to instill you guys with is not just Ajeerna broad heading, it's Nirukti, it's Vyakhyana, it's types, Lakshana, treatment. No. What you have to understand basically is why this Ajeerna happened. What led to Ajeerna? One thing we have is the hetu. So saying ahara, viharaja, nidana, seha, from that we understand. Okay. But this ahara and vihara, what they have taken, how did it turn the body to a diseased state? This part we generally miss. So why? Because we have not understood what is the kriya shareera of the pachanakriya in the body. As like saying the GIT, physiology of GIT, physiology of respiratory system. Now this the prana pavanaha. Only for the respiratory system we read a shloka and we just kept it there. We didn't read about what could have been the nervous system kriya shareera, what could have been the GIT kriya shareera in the body. So that we will learn today. Okay. So this patient has personal history saying diet which is mixed, katu, amla rasa pradhana ahara sevana has been done. So adhyashana and vishamashana are there. With all these, we understand that there should be some changes which has happened with Agni. But till now, we have not thought about what is the change that is happening in the Agni, right? So katu amla rasa pradhana ahara sevana has been that lady has been doing. So what should be the Panchamahabhuta constitution of these rasas? So Kshmamho, Agnikshma, Ambutejaha, Khavayu, Khavayu, Tiktoshana Kashayakaha. So Khavayu Agni, Anila, Go Anila. So now it should be, for the Katu rasa, it should be Anila and Agni. These are the main Panchamahabhuta that she is been taking in her food. And the Amla Rasa Pradhana Ahara Sevana. So what is that Amla Rasa, the Panchabhautic constitution of the Amla Rasa? Shmambhogni, Shma Ambu. So it should be Shma and Ambu. That is Prithvi and Apmahabhuta. So now what she is taking more of Anila, Agni, Prithvi, and Up. So the four Mahabhutas, she is taking food which are mostly predominant in all these four Mahabhutas. Like in Atyadika Sevana she is doing. And about that, what she is doing is Adhyashana. So what could have happened in the GIT, the tract? Just imagine a bolus of the food is starting to travel from the mouth uh, to the Gala Pradesha, then to the Kantha, then the Ura Pradesha, then to the Amashya. So a bolus of food has been traveling. Okay. So what this lady has been doing after 2 hours, just after 2 hours, say it is Adhyashana. So repeatedly she is taking the food. So what is happening in the Adhyashana? 2 hours she took food. It was still in the Amashya, but again a bolus started from the mouth. As this bolus which was there in the stomach moved to the intestine, again there was intake from the mouth. So one bolus was there in the mouth, one bolus was there in the esophagus, one bolus was there in the stomach, one bolus was there in the intestine. So what happened to the movement of the vata now? Has it been impaired? It should be, right? So when the bolus of food is there in the stomach and it has not been completely Jeerna, you should not be taking some other food. Why? Because Vata, Pitta, Kapha, all will go wrong. Predominantly Vata will go wrong. Why? Because it should be in the Anulomana Marga only, but now it has two regions where it has to concentrate. One in the Amashya, one in the mouth. So then the second thing, okay, after 2 hours again she took food. So now Vata has to concentrate on three regions, one in the mouth, one in the esophagus, one in the stomach. So it is like decentralization of Vata. It should concentrate its power into three different regions. That means to say the quality of Vata has reduced. Say if 100 SI units of Vata is there, and now if that 100 SI units of Vata would concentrate only in the Amashya region, the pachanakriya would have gone right very early. But now this is divided into three parts, like say 30, 30, 40. 30 units of vata is there near the mouth, trying to trying for the proper ingestion of the food, and 30 is units of vata is there in the esophagus, trying to push the bolus of the food towards the stomach. And again, there is other 40 units of vata which is there in the stomach region, which is trying to push it still downwards to the grahani region, to the pakvashya region. So what happened now? Vata, what happened to the Vata now? The Anulomana Kriya of the Vata, the Vivechana Kriya of Vata, all these are not are not happening properly. And above that, she is doing Vishamashana. Okay, sometimes taking proper food, sometimes not taking proper food at abrupt times. She's doing this. And appetite is clearly said as decreased since 2 years. Okay, these are the one type of combination where it could have been resulted into Ajeerna first. First mandagni or Ajeerna forming ama state. Then only it would have manifested into a grahani case. This is typically a grahani case, right? So 3 to 4 times in a day, the watery stools are there. For 8 years, it has been like this. So this chronic thing which is going on, it could have been manifested finally as a IBS case, right? So this could have happened in the further stage. But you have to think starting from the stage where it was the disease was just within the 2 years span of time, 3 years span of time. What could have happened? Only if you understand that you can correct it in a very proper way. Saying you should give vamana to this patient or you should give virechana to this patient, or it is just it can be treated with shamana aushadhi, or it should be given basti in case we do give basti to grahani cases, right? So to make this judgment, you have to understand what was the scenario of this case, this grahani case of this woman 8 years back. So in order to understand that, every disease, if I give you every disease of Annavaha Srotas, you would have been seeing the manifested disease 8 or 10 years later, which could be an Atisara case, a Grahani case, or a Pravahika case. But 10 years before, when it was in its starting stage, always and always, it started with Ajeerna. So, before why I'm stressing this point is understanding Atisara is rather easy, understanding Grahani is rather easy in a later stage, right? But how it started, to understand that it's very difficult because you have to imagine certain things, how it could have happened in the GIT, or you have to use your logic, you have to analyze more, which takes a lot of effort. So I want to make that analyzing thing easy for you guys so that you can understand any Annavaha Srotas patient easily. Okay. And this is second case saying a 24-year-old male patient coming to the All India Institute of Ayurveda chikitsa OPD saying there is irregular bowel habits. This is little different case saying mucus stains too. Then burning sensation at the time of defecation. In the previous case, we had the burning sensation in the epigastric region, right? But here it is saying burning sensation at the time of defecation. So what made this change? Where did the Vaigunya change here? And pain in the left hypochondriac region since last 3 years. There, while stool was passing, then there was pain. But here there is continuous pain in the left hypochondriac region. So now can I say that pain were of two different types, as both, even though both the cases are of Grahani, the manifestation is little different. Pain was only at certain time in the previous case. Here there is continuous pain. So which Avastapaka is doing this? What was the stage before of this grahani in the Ajeerna state, which led to continuous pain rather than not in bunch, like saying at only one point of time there is pain, right? There should be some differentiation which is causing this. And also there should be some neuronal mechanism which is stimulating the GIT to create pain or to give out the visceral pain at only certain times or throughout the day. So there should be some differentiation. What is this? Has it been explained in Ayurveda or not? Or is it only the neuronal or the hormonal changes in the GIT system is only with the physiology part of the allopathy explaining you, or is it the Ayurveda which has given at the first place and then only they have taken it? So this we will understand today. Okay. So this is the etiopathogenesis of Ajeerna, saying Nidana, Ahara, Vihara. We will learn this. Then here in the down point there is something called as vitiation of Pachaka Pitta, Kledaka Kapha, Samana Vayu along with resistant kamas, which finally leads to some Sroto Dushtis, that is Annavaha, Pranavaha, Utakavaha. Finally there is formation of Sarakitta, Aparipakvamala, finally leading to Ajeerna. Okay. But why is this vitiation of Pachaka Pitta, Kledaka Kapha, Samana Vayu are all happening? This we have to understand, right? Okay, so this presentation is all about 5 things. First one is Kriya Shareera, that is Kriya Shareera of pachanakriya according to Ayurveda. Then there is hetu and prakara with respect to different ahara, vihara, vyadhi and aushadha. Even giving different aushadas in different wrong combinations or at wrong time or in the wrong dosage, that may also lead to Ajeerna. That also we have to take care. Okay. Then Lakshana, Ayurveda and the modern understanding. Then Chikitsa, Ayurveda and the modern treatment. So then the case discussion to understand different samprapti in which Ajeerna may manifest. These are the 5 things that we need to cover with this presentation. Okay. So first thing is about Kriya Shareera, the conceptualization that we have missed understanding. We know there is hetu, ahara vihara hetu, and we also know that there is the vyadhi which is manifesting lately in the disease course. But what is happening in the middle, the main culprit that we have to understand. In order to understand the abnormality, the first thing we will be understanding is about the normalcy of the Kriya Shareera, right? So normal pachanakriya we have to understand. So in the body we know Vayur Ayurbalam, Vayur Dhata Shareerinam, Vayu Vishwamidam Sarvam Prabhur Vayishcha Kirtita. So Vayu is the one which gives us Ayu, Bala, Ayu Vardhana and good Shareera. Then Vayu Vishwamidam Sarvam. Okay, these things you know. Then there is Prakrita Agni Karma. Ayur Varnam, Balam, Swastham, Utsaha, Upachayau, Prabha. So, seeing this shloka, you will be understanding everything in the body is controlled or should be controlled or is being controlled by Agni. That is Prakrita Agni only. So, how much of importance Agni is all about in the Annavaha Srotas, as well as for all the disease that happens in the body. You guys all know. I did not explain like elaborately with respect to Agni, but just making you revise few shlokas before entering to the actual concept of Pachana. Okay. Then, this is one more shloka from Charaka Chikitsa 28th chapter, giving us the information about how important Gati and Sthana, Prakrita Sthana is about. Avyahata Gatihi Yasya Sthanastah Prakritau Sthitaha Vayuhu Syat. So adhukam jive rita roga samashyatam. So this is saying which person can live for a very long time without without suffering from any diseases. Rita roga. Okay, he can live up to 100 years or more so. So how can he live a life like this? So when can he live a life like this? Is when Vayuhu is in such a state. Which state? Avyahata gati. That is, it should be in its proper gati. Where and all it should go in Tirya Gati, it should go in Tirya Gati only. Where and all it should go in the Murda Pradesha, Urdhva Gati, it should go in Urdhva Gati only. Where and all it should go in the Anulomana Gati, it should go like that only. Okay. Then Sthanastha, which are all the main places where it is concentrated, that has to be preserved like that only. In the Prakrita Sthana only. So when and all there is Vyahata Gati. Avyahata is in its normalcy. Vyahata is in its abnormalcy, that is not in the proper state. So what can be the gatis? How can we understand the types of gati in the samprapti related to Ajeerna? So that is one way of saying gati is kshayaha sthanam cha vriddhishta doshanam trividha gati. Another type of gati is there. What is that? Urdhvam cha adhascha tiryaksha vigneya trividha apara. Then again the third type of gati is there. What is that? Trividha cha apara koshtha shakha marmasthi sandhishu. So understanding the deviated gati, just not with the vayu, also with the kapha and pitta. Why the importance is given for vayu is it is only the vayu which has the chalaguna. So that is why it has been given importance. So how many types of gati we discovered now? Kshaya sthanam cha vriddhishya. So gati can be the kshaya of the dosha, the vriddhi of the dosha, and sthana, that is in the normal quantity of dosha, also called as gati. Please remember this, students. Kshaya, sthana, and vriddhi are also doshas, three gatis. Then urdhvam cha adashya tiryaksha. This is according to the karma. Okay. So according to the karma, like in which angle it is moving, which direction it is moving, the gati of the vayu can be another three types. That is urdhva, adha, tiryak. Then trividha cha apara. That means to say where this doshas is going to settle in koshtha, in shakha, in marmasti sandhishu, where and all they can manifest a disease. Their action site, that also is called as the T. So when in the samprapti of Ajeerna, when in the samprapti of Grahani, Atisara, anything, any disease it might be, Gati, when it is mentioned, just not think of dosha going dosha kshaya dosha vriddhi, or it can be dosha urdhva dosha adha dosha tiryak, or it can be dosha which is placed in koshta shaka marmasti sandhishu. Okay, what is this called? This type of understanding the samprapti of any given disease, here we have taken it as Ajeerna. This is called as vidhi bhedena doshanam trividha gati. So according to what this gati has been defined in three types? According to doshanam trividha gatihi, according to vidhi bhedena. What is this vidhi then? So we know that samprapti has 5 or 6 other different types given in the Charaka Nidana Sthana first chapter, saying Sa, Sankhya, Pradhanya, Vidhi, Vikalpa, Balakala, Visheshaihi, Vidyate. So according to this Vidhi Bheda, that is one kind of understanding the Samprapti. So this shloka, the Shayak Sthanam Viddhishta shloka, has been given in Kiyanta Shirasiya Adhyaya. Whereas the Sankhya Pradhanya Vikalpa is given in Charaka Nidana Sthana first chapter. And the first thing where we started this discussion is from the shloka which is there in Charaka Chikitsa 28th chapter. So just for understanding the Ajeerna, what is the previous process that we have to undergo, and then we have to land up in diagnosing it as Ajeerna? What is the effort that has been there, that should be there in understanding? If you leave out on all this, you might not understand what is Ajeerna exactly. Okay, so I just want you to revise all these shlokas, because Charaka has not given, as we know, Acharya Charaka has not given Ajeerna as a separate vyadhi, or a separate chapter has not been dedicated to it. But while we are understanding the Ajeerna, we are understanding different shlokas from different sthanas of Charaka. So now can we say that, still after knowing all this, can we say that Ajeerna has not been explained by Charaka? Or some other disease which has not been there in the Charaka, like Amla Pitta. Amla Pitta has not been explained in Charaka. No, it's not like that. The Samprapti, the hetu, the samprapti, purva rupa, lakshana, different gatis of the dosha, everything has been explained. but you have to just wear a different spectacle to keep a different microscope to develop within yourself a different vision to say, okay, this is how it is. This is how I should connect two or three different shlokas from different sthanas of Charita Samhita. Okay. Now here comes a picture. This gives you the idea. Okay, this might be GIT. There are some two other organs which is not generally placed in terms of GIT, that's liver and spleen, but then that's also comes under GIT. Finally, there is one picture which is showing almost every other organ that's there in the trunk region. So in GIT, we say, like in the modern physiology aspect, the digestive system, any physiology of the digestive system is just in accordance, is attributed only to gastrointestinal system. But how has Ayurveda understand about the pachanakriya? What is koshtha then? So Ayurveda Acharyas, as you guys all know, that Ajeerna, you all confidently say it's one vyadhi of the Abhyantara Roga Marga, right? So what is this Abhyantara Roga Marga then? Koshtha punaruchyate mahasrotah shareera madhyam. That is the trunk region, the first picture. Shareera madhyam mahanindam. That's a large space is there. Mahanindam in the mid part of the body. शरीरमध्यं महानिन्दम् आमपक्वाशयः च इति. Amashaya, Pakvashaya, other Ashayas. Lecture is mentioned. So Amashaya, Pakvashaya, and other Ashayas are there in that place, which is called as Koshtha, which is called as Mahasrotas, which is also there in the mid part of the body. Sa Roga Marga. This part of the body is called as one Roga Marga. Say Abhyantaraha. The name of this Roga Marga, which is there in the mid part of the body, constituting different Ashayas. For example, Amashaya, Pakvashaya, etc. This is called as Abhyantara Roga Marga. Uktam sa Koshtha Vivarane. So they have given Abhyantara Roga Marga is a place which is called as to be Koshtha. So what is this Koshtha? Sthanani Ama Agni Pakvanam Mutrasya Rudirasya cha Vit Undukah Puppusascha Koshtha ityadi diyate. So this Abhyantara Roga Marga is not just Amashya Pakvashya. Okay, so the GIT system, what they have understood in the modern term, saying only stomach, esophagus, stomach, small intestine, large intestine, the rectum, and the anus. Just not this is that which is acting as the pachanakriya sthan. Okay, please take out this notion from you now. For the uh, for the digestion to happen properly, it is not just the GIT system that has been explained in the modern physiology is doing the work, but rather it is Koshtha that is doing the work. What are all the Koshtha Ashayas then? Sthanani, what are all they? Amashayaha. See the second line of the shloka. Amashayaha, Agnyashayaha, Pakvashayaha, Mutrashaya, Rudhirashaya, Hrit, Unduka, Puppusa. All these contributes to Koshtha. This Koshtha is called as Abhyantara Roga Marga. Okay. So we first only concluded that Ajeerna is the vyadhi of Abhyantara Roga Marga. So Ajeerna, now where and all it can happen. Are you getting the idea? Where and all Ajeerna can happen. Okay. So Arogya Manjari, this is given in the Madhukosha commentary. Okay. So it says, Udgare api vishuddhatam upagate kanksha na bhaktadishu snigdhatvam vadanasya sandishu ruja krutva shiro gauravam manda ajeerna rasetu lakshana vidam. So it is saying what is the general lakshana, that is the samanya lakshana when there is ajeerna. What it can be? A few combination, a list of symptoms have been given. What are they? Udgare api vishuddhata upagate. Even though there is udgara and we feel like okay, the digestion has happened now, but in those persons, in those patients, there is no kanksha, that there is no ichha for eating, like to take the next meal, there is no ichha. Snigdhatvam vadanasya, that is, there is a coating in the oral cavity. Sandhishu ruja, ruja, there is pain in the sandhi. And also shiro gauravam. So where and all you can relate here. So what is Ajeerna now? Is it indigestion? Is it just indigestion? Manda has been given, Manda term is given. So of course, it is one part of Ajeerna can be understood as indigestion. So what are all the other things? Some patients say, uh, I don't feel hungry, but rather when my stomach is empty, I feel like my head is paining a lot. This headache. I don't feel hunger, but I suddenly get headache. Then I understand that I have to eat now. That's I'm hungry. But they don't feel it in the stomach, rather they're feeling it in their head region. Okay, this is Ajeerna. Don't neglect this symptom. Second, Sandhishu Ruja. There is no particular hetu, like any Agarthaja hetu is not there, or any Abhyantara vyadhi, like it might be an osteoarthritis case or a rheumatoid arthritis case. No, such case is not there. But still, the patient says, I'm not feeling that enthusiastic, but rather I feel very lazy. I feel pain in my joints, a generalized kind of a pain. Okay. But how do you understand this? There cannot be a vyadhi which has still manifested, but this is in the Purva Rupa Avastha of any vyadhi. Even though it was osteoarthritis, even though it's rheumatoid arthritis, or any other Sandhi related cases, the Purva sthiti of that was Ajeerna. That is Sandhishu Ruja was there. Then Snigdhatvam Vadanasya, buccal cavity. So there is saliva, I understand there should be some snigdhata, but apart from that, if they are mentioning as snigdhatvam vadanasya, there should be some coating in the buccal cavity, either in the inside part of the cheek or all over the tongue. There should be some snigdhata. So don't neglect this symptom as also. Then bhaktarishu na kanksha. The person is not at all feeling to eat something. There were four words in Charaka Sutrasthana 28th chapter. Can you recall that? Saying Annavirasya, Asya Virasya, Annadvesha, Anannabhilasha, Virasagnata. These were the different terms which are said just regarding Bhakta Vishu Nakangsha. This can be different varieties of patients. It's not that Acharyas had they were so intelligent they wanted to give different terms. No, it's not such that. It is to say that these can be the presentation in the patients at the very early stage, saying these patients may end up in Ajeerna. If not treated, they again come up with a rasa pradoshita vyadhi. Then also, if not treated, they end up in some other dhatu pradoshita vyadhi. This is how the pathogenesis is. This is how the samprapti goes. So these lakshana you have to keep it in mind while you are understanding about Ajeerna. Okay. Even before classifying it as Vidagdhajeerna or Amajeerna or Vishabdajeerna, these things, four things you have to remember. What are they? Even though there is Udgara after the food, after the previously taken food, but there is no Kamsha. Bhaktarishu na Kamsha. Second point, Snigdhatvam Vadanasya. Third point, Sandhishu Ruja. Fourth one is Shiro Gaurava. This happens when there is Manda or Ajeerna Rasa in the body. Ajeerna Anna Rasa. Okay, Ajeerna Anna Rasa is there in the body. These are the four things that can happen. Tatra Ativriddhe Punaha, if this state keeps on continuing, say this was there for day one, but the patient did not take any medicines or did not consult the doctor, or even the doctor could not diagnose as the state continued for 1 week or 1 month. Then what happened? Punaha Hirillasa Jwara Murchanadicha Bhave Sarva Amaya Shobhana. So this is the thing which happens as the Purva Rupa state of every Amaya that is going to come further. So please keep a note of these 4 points. This is the primary presentation once you sit in the OPD. I hope you guys are attending the clinical classes and you are taking cases. If you are not doing it, please start doing it. While you start with the patient, these are the four things that you have to ask the patient. When these four things started, Then you can chronologically say the chronicity of the vyadhi that they are presently having the complaints. The patient might say, I'm just having this complaint for 2 or 3 months, but the actual chronicity would be 2 or 3 years because these symptoms might have started already. Okay. Okay. Then further, Sushruta Acharya says one very important point. As I had asked you a question right before, saying about is there any Acharya or Samhita which is saying about the neuronal control and the hormonal control of the GIT tract as explained in Ayurveda. This is the shloka saying, Swalpam yada dosha vibadha mamam leenam न तेजः पथम् आवृणोति भवत्यजीर्णे अपि तदा बुभुक्षा सा मन्दबुद्धिं विषवन्निहन्ति. So this is saying about a term called Teja Patha. What can you say about this Teja Patha? It is saying the information about the mesenteric and the endocrinal system that which are playing behind the curtains in the stomach region. There are mesenteric nerve plexus, endocrinal system which is there, the hormonal system, like example the gastrin, the cholecystokine, the secretin hormones. These are all there, and the hunger. When and all you feel hunger, your brain has a pathway from the stomach to the brain, saying now you're feeling hungry, so go eat. Okay, this is stage of patha. This is not just explained as some vagus nerve or some other endocrinal or hormonal system just in the modern physiology. It is actually Ayurveda which is saying about the stage of Patha. When the stage of Patha has gone into Avarana, then even though your stomach is empty, your stomach might not give a positive feedback to the brain about Bhakta Akanksha. So when there is Avarana, even though there is empty stomach, there is no positive feedback. That's why the patient is not feeling Bhakta Akanksha. Bhakta Adishu na Kanksha is the shloka we read. Okay. Next, hormonal control of the gastrointestinal motility. These are the hormones I mentioned just now. Gastrin, cholecystokinin, secretin, gastric inhibitory peptide, motilin. These are many other different hormones which are playing a very important role in the GIT physiology. Okay, this has been explained in Ayurveda. And neuronal control of the gastrointestinal motility, the sympathetic and the parasympathetic, these are all controlled by Vata. How it is controlling? See the shloka, you'll understand. Vayuhu tantra yantra daraha. Okay, it is the controller. It can control prana, udana, samana, vyana, apana. Then it is the controller which says pravartakah sheshtana, that is the sympathetic nerves. Sarva Sharira Dhatu Vyuhakaraha Sandhanakaraha Sharirasya. These are the actions of the parasympathetic nerves. Then there is Samirano Agnehe. Agni, the controller of the Agni, is the Vata. Dosha Samshoshanaha. So which dosha has to decrease, which dosha has to increase. Not in the pathological quantity or quality. In the physiological activity as also. In the first stage of digestion, there is Kapha. In the second stage of digestion, the Pitta is acting, like Pitta is doing the actual activity. In the third stage, Vata is doing the activity. So who controls this? It's Vata. Okay, Prakrita Vata. Then Kshepta Bahirmalana. Mala is already produced and it should be sent outside. Bahirmarga. So that also is done by the Prakrita Vata Karma. Then Sthula Anusrotasam Bheta. So stomach, if you consider it is Sthula Srotas. If the single cell in the mucosa or like say in the peptic cell, there is gastric cells, there is other oxyntic cells, all these also have smaller part to contribute to the digestion. These are all anusrotas. So which is that dosha, which is that thing which in the body that which can enter both the sthula srotas as well as the anusrotas, that's prakrita vata. So now are you getting the idea about how this hormonal control and how the neuronal control in the gastrointestinal system is happening? This is with Vata. And also it is saying in the Ashtanga Sutra 12 chapter saying Utsaha Uchvasa Nishvasa Cheshta Vega Pravartanaihi. So any cheshta to happen, any vega pravartana had to happen, it should be the vata which is doing the activity. Samyak gatya cha dhatunam akshanam patavena cha. So all the sensory organs and also dhatu to go in proper gati. Gati, now we understand there are three kinds of gati that can happen. So for all this gati to be in samyak avastha, it is vata which is playing the role. So how important the vata is now in understanding the physiology as well as the pathology. That means to say in the physiology of understanding the pachanakriya and in the pathological state of Ajeerna, how important vata is. So this just explains once the Ajeerna is happened, Ajeerna has taken place, what are all the other rogas that can happen in the Abhyantara Roga Marga. Chardi, Atisara, Kasa, Shwasa, Udara, Jvara. We tend to neglect these, right? Kasa, Shwasa. We don't generally think it as something which is related to Agni and Amashaya, Pakvashaya. We don't generally think it that way. We just say Kasa, Shwasa is related to respiratory system. No, this is why, because our understanding has gone wrong. We are saying about a vyadhi which is explained in Ayurveda, like the explanations given in Ayurveda, but saying it in terms of modern, saying it's a respiratory system disease. No, not at all. Abhyantara Roga Marga is the one where the Kasa, Shwasa, Chardi, Atisara, Udara, even the Jvara is manifesting. So keep this in mind for all these diseases. Ajeerna is the first state. So, where and all Ajeerna can manifest being an Abhyantara Roga Marga Vyadhi. It's now you can call it as a root bug. Okay. So now to understand how this Ajeerna is going to manifest in the body, we have to understand which are all the doshas that take an active part in the pachanakriya. First one for the anna pravesha, for the food that you have taken inside, for that food to go inside the body, to go to the kosha, to go to the mahasrotas, it should be the pranavayu. Okay, that is helping. In the second place, to move in the esophageal region, in the mid part, that is udana vayu and pranavayu, which are both functioning. Third one is of the samana vayu to collect it, to collect the ingested food into the main part of the mahanimna, that is the ama, shaya, agnyashya, pakvashya. For the movement of the food here, it is the samanavata which is doing the activity. Then fourth is about the pachaka pitta. Okay. And the fifth one is about the pledika kapha. So now think Ajeerna on a bigger aspect, you divide it as Vidagdha, Vistabdha, Amajina, Rasasesha Ajeerna, and so on and so forth. But in what and all sites, in what and all stages of the food ingestion, food digestion process, Ajeerna can manifest. So now Ajeerna can manifest with respect to a deviated or abnormally behaving pranavayu, abnormally behaving udanavayu, abnormally behaving samanavayu, abnormally behaving pachakapitta, as well as abnormally behaving pledikakapha. So now, did the scope of Ajeerna become more and more? Did it expand? I hope it expanded your vision now. It's not just about Ajeerna being in six types, but rather Ajeerna, how it is happening is because of the wrong play of these doshas, these subtypes of doshas. Okay, so the picture I showed you from the mouth till the anus, these are all the things that are there. Pranavata, Udana, Klerika Kapha, Samanavata, Pachakapitta, Agni, and the Kosha, the Malapravritti. Okay, so Ajeerna is a play of subtypes of Tridosha, turning out the normal Kriya shareera, that is the pachanakriya, into a pathological state. So now we will understand for the Ajeerna to manifest, Agni has to go wrong, right? So what is this Agni? In other words, some Acharyas say it is Annasya Pakta Pittam tu Pachakakyam Kureritam Dosha Dhatu Maladina Ushma Iti. So while this Pachaka Pitta is doing the Pachana Kriya of the doshas, Dhatu and Mala, it is in fact acting as Agni. So Dhanvantari Mata, they say Pitta as a Pachakam, and the Atreya Mata, they are mentioning it as properly as Agni only. So there are 4 types of Agni. That's Tikshna, Manda, Sama, and Vishama. Every type of Agni has its own different qualities. Then Tad adhishtanam annasya grahana grahani mata. So what is the grahani doing now? What is the ajnashya that we understood in the koshta? While mentioning about the koshta, we described which are all the koshtashayas. In that, the first one was amashya, then ajnashya, then pakvashya. So what is this ajnashya then? That adhishtanam annasya. That agni is the ajnashya is the adhishtana for grahanat annasya. That grahani is the is the stage where the anna is undergoing the grahana. Then it is also called as pittadhara kala, in other words. So where and all you find the term of pittadhara kala, you find this in Atisara. Okay, you find it in some vata vyadhi also. Okay, so these are all the pittadhara kala. Don't just get confused as this is something very different. No, this is grahani. Okay, this is Agnyashya. So even though it's a Vata Vyadhi, even though it's some other neurological disorder, some other vascular disorder, it is the play where the stage is set for the disease to manifest is Grahani. So in different prakritis, we see Vata Prakriti, these rasas they try to eat more. Vata Prakriti person. In Pitta, they try to eat more of Madhura Kashaya Pitta, Shita Guna. Then in Kapha Prakriti, there is a very peculiar shloka in Ashtanga Hridayam, Shareera, 3rd chapter, saying, Tiktam Kashayam Katukoshna Ruksham Alpam Sa Bhukte Balavam Sathapicha. So it is about saying, whatever or whichever the rasa they might uh, try to take more in quantity, but even though this Kapha Prakriti person eats very little, but he gets satisfied with that only. He gets proper nourishment with little amount of food only. So can I say like the Tikshna, in the previous slide we read about the 4 types of Agni, right? That's Tikshna, Manda, Sama and Vishama. Here we understand, we generally try to say as Pitta Prakriti person has Tikshna Agni, Kapha Prakriti person has Manda Agni, Vishama Agni is with the Vata person. So is it like Vata Prakriti predominant person is always in disease state, and Pitta Prakriti, because of the Tikshna Agni, he never gets a disease? No, it's not that. For that Prakriti, Vishama Agni state itself is the normalcy. For Kapha Prakriti person, Manda Agni state, that is to get satisfied just with little quantity of food, is itself the natural state. If this gets deviated, that means to say he or she is at the risk of getting Manda Agni more, the Kapha Prakriti. Pitta Prakriti is like getting into the risk of Tikshna Agni more. In that state, getting the disease at that state is more. It's just that, not that the Tikshnagni person will never get a disease, or Vishamagni person is always getting a disease, or Mandagni person is already in the disease. No, it is not that. So Manda, Tikshno, Atha Vishamaha Samashcheti Chaturvidaha, why it is attributed to Kapha, Pitta, Anila? Just because those Prakriti person are at the risk of getting this kind of Agni more. Mandagni, Tikshnagni, Vishamagni. So how do you understand the Agni? It is from the Jarana Shakti. So now we have understood the Kriya shareera of the digestive process. That is the pachanakriya in Ayurveda terms now we have understood. So while jumping further into the Ajeerna, we understood that we have to take care of pranavata, how is it in the person. Like the pranavata and the udanavata in a obese person, the activity of prana and udanavata would be restricted. So he getting the Ajeerna avastha is little more. Risk is little more. And the Krisha person might not get that Ajeerna thing more. Right? He can sustain it for longer time. Say some patient can manifest this IBS in 8 years, some patient can manifest it in 10 years. How it differs? because of the Agni sthiti. अन्नस्य पक्ता सर्वेषां पक्तॄणाम् अधिको मतः तन्मूलास्ते हि वृद्धिक्षयात्मकः तस्मात् तं विधिवद्युक्तैः अन्नपान इन्धनैः हितः पालयेत् प्रयस्तस्य स्थितौ हि आयुर्बलस्थितिः. So if you can maintain palana, if you do the palana of Agni properly, this Ajeerna avastha you might not end up into. So Sarva Agnishu Jathara Agnihi Pradhanam Maha. So Ajeerna, when we are explaining, it can be explained in terms of Datva Agni also, Bhuta Agni also, but predominantly why we are explaining for Jatra Agni is because Sarva Agnishu Jathara Agnihi Pradhanam. Apakvam dharayati annam, pakvam sujati parshvatah. So if there is apakva anna, it undergoes dharana. That means to say, digestion process takes about 3 to 6 hours, right? So what is actually happening? Why is it taking 3 to 6 hours? That's because the apakva anna has undergone dharana in amashaya for certain time. At once, when it turns into a pakva state, it is given to the further koshta parts. So apakvam dharayati annam, pakvam srujati parshvatah. Pakva, if that anna becomes pakva at certain stage, then it is sent to the next place for the digestion to happen. Sa dushta bahusho bhuktam amameva vimunchati. So if one takes more quantity of food, or if the digestion process is taking a long time, then what happens? Bahusho bhuktam amam eva vimunchati. So that person is certainly to get into the ama stage, then into the Ajeerna state. Yatascha यतश्चायम् अन्तरग्निर्मूलं सर्वत्र तस्मात् तं पालयेत्. Okay, these are just for the revision point. Grahani doshajan iti grahanyashrita doshajan. So now we have come to an understanding what is Pittadhara Kala, what is Grahani, what is Agnyashaya, and where is Agni. Agni is not something an abstract term, you know. Agni is something which can be proven, which is there inside the body, which is pratyaksha. Or it can be pratyaksha in the sense uh, there is something which is staying in the body. That's Agni. Agni is not something which we cannot understand at all. It is not such a term. But Agni is there. For that, there is some ashaya. There is some stage. There is some place where Agni is held in the body. That is Agni ashaya. That is Grahani. So any dosha that is happening with respect to Agni is bound to bring a deformity in the Grahani. So that, and further the Grahani rogas. Tatha Agni Mandya Ajeernadayascha. So only here, until now, while we were discussing about Koshta or in the Roga Marga or anywhere else, other things were said like Chardi, Atisara, Shotha, Jwara, Kasa, Shwasa, all were said. But nowhere Ajeerna was mentioned as a disease in particular. Right? Can you recall it? Until now, even though we are discussing Ajeerna as such a big disease, nowhere Ajeerna has been mentioned directly as an Abhyantara Roga Marga disease. It is just our understanding. But where it is mentioned in Charaka Chikitsa, not the Sutra chapter here, sorry. Charaka Chikitsa, 15th chapter, saying Tatha Agnimandya Ajeernadescha Grahanyashrita Roga Gruhyante. So once they say Grahani, it is Abhyantara Roga Marga. Okay. So why Bala of the Agni is so important? So it is because of Bhuktam Amashaye Rudva Sa Vipachya Nayattidaha Balavatyabalaat to Annam Amam Eva Vimunchati. So once we take Amashaya, well, in the Amashaya, once the Bhukta, the Ahara has come into the Amashaya, then further it has to be brought below. Right? What decides at what time this food has to be brought to the Agnyashya, to brought to the Pakvashya? What decides it? The quality of Grahani, the quality of Agni, the quantity and quantity of Agni, quantity of the the quality of the environment that is being given in the Grahani, that which decides at what time this Bhuktam Annam in the Amashaya has to be brought to the Agnyashya or to be brought to the Pakvashya. So with this shloka, are you understanding that Acharyas had an understanding of something called as bacterial habitat, or even the duodenal activity? The bile has to come to the what bile has to come to the pancreas. The pancreatic enzymes has to come to the pancreas, to the duodenum. Then they have to come to the small intestine. So are you understanding that they had a clear picture of why the ahara stays in the stomach for certain time, and then it comes to the small intestine, then it comes to the large intestine. So they clearly knew. That means to say, for certain time it has to be in amashya, for certain time it has to be in pakvashya. So now Ajeerna got a second scope of understanding, saying if at all the vyadhi, if at all the dosha is happening in the amashaya, then also Ajeerna can happen. If at all the pathology is in grahani, then also Ajeerna can happen. If at all it is in the pakvashaya, then also Ajeerna can happen. So this is the second kind of understanding. So grahani mashritam rogam ajirnavad upachare langanair deepanayesha sada atisara bheshajai. So this is one shloka from the Bhava Prakasha Atisara Adhyaya, saying any dosha that is there in the grahani, you always have to treat it as like ajirna. So now did you understand whether it's a grahani roga or whether it is an atisara or any other Annavaha Sroto disorder? The first stage of it is always ajirna. So even though the patient might come to you as in the presentation of IBS, in form of Crohn's, in form of ulcerative colitis, or in any other form of the GIT disorder, the first thing what you have to do is to understand what kind of ajeerna has happened in the person. Then only you have to go to the manifestation, particular manifestation of the roga. Okay, so today I'll stop here. In the next class, we can continue with the types of Ajeerna, the Lakshana, specific Lakshana, and some cases, and how to decide with the treatment of Ajeerna. Okay, I'll stop with the shloka, then we can go for the doubt session. रागादिरोगान् सततानुशक्तान् शेषकायः प्रसृतान् शेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै